Government. This is State Circle.
Good evening. Welcome to State Circle. We begin this week with a coronavirus update. Some parts of Maryland are rolling back their reopening plans as cases of COVID-19 accelerate across the country. The number of Marylanders hospitalized for the virus topped out above 1,700 back in May, dropped to under 400 2 weeks ago, but now is back up over 500. Our newsmaker this week is Panagis Skaliacedos, an assistant professor in the Division of Pulmonary and Critical Care Medicine at Johns Hopkins and also co-chair of the Health Equity Steering Committee. Doctor, thank you for being with us.
Nope, it's an honor to be here. Thank you, sir.
You just launched this week a new online curriculum for kids about the coronavirus. I want to talk about that. But first, from your standpoint at Hopkins, you know, we're starting to see maybe the trend edging in the wrong direction here a little bit. Obviously, a lot worse in other places. What are you seeing in your practice?
Yes, so being a critical care physician, we've all been redeployed in the intensive care units that have been remade just specifically for COVID-19. I can tell you back in March and April, especially April and May, those COVID-19 intensive care units were packed. Around June, we began to all kind of catch a breath of fresh air. And especially, you know, Hopkins has 2 hospitals in the city. At the Bayview side, we began to see kind of a nice reduction in COVID-19 intensive care unit cases, so the most severe cases. And that was a good reflection on the overall trend that we were seeing in the city, and to some extent, a good proxy for the state. But you're right. Right now, we are seeing a bit of an uptake in some of the cases coming back into the hospital. And so that's concerning, of course, everyone. I think using the hospital as a barometer for how well we're doing is always important, because that's the place you go to continue receiving health and medical attention. So yeah, a lot of us are right now, the breath that we caught, now we're kind of holding it to see what's going to happen.
It's a good place to ask about your best advice for people to not catch this. What works, what maybe doesn't work?
So that's actually a really good point, right? I always like to emphasize to whether it's a community member or a patient that we're discussing on the phone or telemedicine, we don't have a vaccine yet. We don't have a cure. The only thing we can do to help fight this is to just not catch it to begin with. And and to do that, we take advantage of, well, what is the biology of this virus, right? We know we know you get infected by breathing it in, right? So it's a respiratory virus. We know the closer you are to someone as they breathe it out, you're more likely to catch it. We know it can stick to your hands and it can't infect you through that, but if your hands bring it to your eyes, nose, or mouth, you'll get infected. So knowing these characteristics of the virus, well, let's use it against it. Let's do physical distancing. Let's wear a face mask that covers your nose and mouth, and hand hygiene. I actually always discuss with parents, patients, and kids, if you really are mad about this virus, right? Wash your hands aggressively, right? Take your anger out there, because you actually are killing the virus. You really are. So it's what better imagery than just really taking it to the virus. But all that said and done, the only way to combat this virus right now is to just not get it at all. So that's my strong recommendation that I keep emphasizing over and over again. And with that information, by the way, I make it very clear, that means us doctors and nurses and so forth, we're your last line of defense. If you all abide by these requests, it means you're now the front line and you can help people stay safe and not catch the virus.
You're doing outreach events in the East Baltimore communities around the Hopkins facilities. What is the message there?
So the message is twofold. One is we're all in this together. As a physician, one of the most humbling things that I've seen from this virus is the inability for us to really cure it, right? Yes, some new treatments have come up and so forth. That's really to help the most severe cases, right? Those who are fighting for their lives, and we're trying to help them. You know, going into the COVID-19 intensive care units, you know, these patients that we would get, you know, they stay there for weeks on end. And if you think about this before the pandemic, you know, most patients that come into an adult intensive care unit, you usually can cure them within 2 to 3 days and they're out. For the for the most common causes of reasons for admission. So I say this because I take this information to the community and I say, we are your last line. We support with whatever interventions we can offer, but we can't cure this. And so really, again, the best way to fight this is to just not get the virus. So we work with the community. So the first thing we deliver is this notion that we're all in this together. Regardless if you're a doctor or just a parent or just a nurse and so forth, not just, by the way, we're all important in this, but I make it clear that we all have a shared responsibility to fight this pandemic. And then the second conversation is that we've delivered to them is, here's your guidelines, here's what we're saying. Now tell us what your barriers are that's keeping people in your community from really following through with these at 100%. We want to hear those barriers, right? We want to understand what's going on because these guidelines, they're not equal. Certain areas can definitely abide by them much easier. People with homes that can rack up food for the next 3 months and just work from home, they're good to go. But others, I grew up in Highlandtown. Those homes, they're great, they're modest, but they'll have a week's worth of food and people then still have to go back out. The majority of people living there are similar to the people I grew up with, where they have to go and work. Zoom meetings and so forth are not, they're not what they do. It's not what their occupation's for. So we have to be cognizant of that, and we have to work with the community. We can't just tell them, here's the guidelines. We have to work to see, well, how can we help them and really prioritize what's going on with them to make an impact.
And part of the educational outreach is this new online curriculum that you've created. The idea for that came from teachers?
Yes, so actually going back to the community engagement, it's something that we've been doing at Hopkins Bayview for almost a decade. The initiative there is called Medicine for the Greater Good. And we work with a variety of other organizations at Hopkins, one of them, the Baltimore Breed Center. And a few years back, we launched an initiative really aimed at pulmonary, lung-related disparities with the notion of tackling air pollution and tobacco smoke. And so with that, we've been able to partner with a lot of great teachers, one of them coming out of Armistead Elementary, again, in the east side of Baltimore City. When the pandemic hit, everyone went into online class learning and so forth, the partnerships that we had from the past, these teachers actually reemerged, right? And they were emailing me. And they're like, Dr. G, we just want to be a teacher. And the only thing our students want to talk about is COVID-19. And that's not a blame to the students. It's we're in a pandemic where they want to know more, but these teachers just want to teach. They want to know the curriculum and teach the curriculum. They're not COVID-19 experts. So they asked me, they're like, hey, you're a lung doctor, you're in critical care. Can you come in the classroom, just talk about this? And so we began doing this and we saw an amazing response from these students.
Our thanks to Dr. G. Educators interested in the curriculum can contact Hopkins at mgg@jhmi.edu. That's mgg@jhmi.edu. Now, many of the largest school systems in Maryland have indicated that they'll be resuming school entirely online in the fall. Our Nancy Amato reports on the passionate debate over what is best for the kids.
I think for me and my family, I think it's really important that kids get back to school and that they start getting back into the socialization because they're spending all their time on their devices. They're, not interacting well with each other.
Denise Sullivan says she's anxiously awaiting for the Frederick County school system to announce if her kids will be back in class this fall.
I think the studies are showing that children aren't as, contagious if they do get it, and they're not getting it certainly at the rates that adults are getting it. So I think that I feel better about that.
On the other side,
I'm gonna keep my son home until it's safe enough to send him back to school.
are parents like this one in Montgomery County who says he supports the school district's decision to start the school year with online instruction only.
Kids are not the cleanest people. So I would rather my son stay home and, I know he's safe there.
Many are scrambling to figure out how to make distance learning work when they themselves are working. This woman says come fall, she'll be with her 4 grandchildren, monitoring their work every day as their parents work.
It is a major challenge, but we can do it. It does take a village, and we will stick through this. moving forward, we just have to make sure the students are safe.
But distance learning may not be for everyone. That could be why homeschooling groups are reportedly seeing a huge influx of interest from parents who are considering taking their kids out of public school.
We try to help parents understand is that financially, everything is on them.
Alessa Keener is with the Maryland Homeschool Association. She advises for parents to do their research if they plan to homeschool as a short-term stopgap measure, especially if their child has an IEP or individualized education program.
What that could possibly mean, worst case scenario, is that the child will be exited out of the IEP. They will lose all their services. And then when they re-enroll, the family would then be responsible for beginning the whole identification process anew. We just encourage families, don't make any assumptions. Talk to your school guidance counselor, your IEP teams, whoever the administrator is. Get as much in writing as you can possibly get, so that way there's no surprises.
Some parents we met in Germantown say they want to give long-term distance learning a chance as long as their kids are engaged and learning.
If they have like online school, then not just 1 hour, maybe more, maybe at least like 4 hours.
I'm Nancy Yamada for State Circle.
Joining us for the political roundtable this week, Delegate Julian Ivey, a Democrat from Prince George's County, and Delegate Jason Buckle, a Republican from Allegheny County. Thanks, both of you, for your time. Delegate Ivey, you had an op-ed in the Sun this week repeating your call for a special session of the legislature, for the legislature actually to call itself back into special session, which can be done. I don't remember seeing it, but it can work that way. What would the purpose be? What would the issues be?
Well, thank you so much, Jeff, for having me on today. You're absolutely right. I'm calling for a special session of the Maryland General Assembly. We've had special sessions in the past to raise taxes, to expand gambling in the state of Maryland. It's something we do. And quite frankly, in this moment, in 2020, it's something that we need to do. We need to ensure that individuals aren't evicted, aren't foreclosed on throughout this pandemic. We need to ensure that individuals working on the front lines have proper PPE and are receiving hazard pay. We absolutely need to make sure that we address police brutality and increase transparency and accountability within our police departments. We've seen protests erupt across the nation, and right here in the state of Maryland as well. People are demanding change, and they're demanding that we act now. And that's why I'm asking that we reconvene for a special session.
Now, your party, the Democrats, you have enough signatures that you could make this happen, but I notice it hasn't happened yet. So what are you hearing from people who are declining to sign on to the petition?
Well, I've heard a few different arguments, but the most pressing is that we're trying to figure out how we can do it in a safe manner. And so we've asked the Attorney General to give his opinion on how we would actually conduct a special session coming up soon. But also we need to know how we are going to be able to have our session in general in January.
You know, Jeff, I think I share some of the frustrations that I can assess, that I can feel from my colleague, my friend Julian Ivey. We served together on the Ways and Means Committee, and he's a great guy. I too have some concerns about the weird way our system works. The reality in Maryland, when the legislature is in session, the legislature is sort of the predominant force with respect to public policy and legislation and actions. When we're not in session, as we're not for the majority of the year, as we're not right now, we don't have the same ability to influence public policy. When you're at a place that we're at in America today, in Maryland today, when we're dealing with these unprecedented circumstances of the COVID-19 pandemic, the policy responses to it, when we're dealing with the civil unrest and the issues that have arisen in policing over the last few months, I think all of us would like to say we're going to be part of the solution. We're going to be part of the debate. We're going to get to work. It's difficult to do that when we're not in session.
Well, let me drill into, if I can drill into some of the issues for a second. Delegate Buckle, you were in Annapolis yesterday, one of the leaders of a pro-police rally, which I'm guessing would be opposed to the legislation that Delegate Ivey is talking about, which would ban chokeholds.
I think that, I mean, it depends. It's a nuanced thing. I'm privileged. I'm happy to serve on Speaker Jones's police reform work group. that we're continuing to work through these issues and having a variety of hearings and information presented to us. I was there yesterday. I'm a very strong supporter of law enforcement and of the concept of law and order, because I think it's the bedrock of our civil society. I don't think that you can, my grandmother used to say, you can't throw the baby out with the bathwater. And I don't think that you can take the actions of a few officers or a few instances that are horrible, deplorable, terrible instances that have to be investigated, have to be prosecuted. Those folks should not be wearing a badge and be representing us as police officers. But you can't take a few of those actions or a few of these incidents and extrapolate that to policies that may not work and policies that may be dangerous. So chokeholds in particular, if someone presented a bill to me tomorrow and said what Derek Chauvin did in Minneapolis, applying pressure to someone's throat, windpipe, chest area, after they've been restrained, after it's obvious and reasonable that they're no longer a threat to the officers, to anyone else, I'd vote for that in a heartbeat. You shouldn't do that. You can't do that. It's criminal to do that. On the other hand, if someone said, for example, a 6'5", 285-pound man is charging an officer or charging an innocent potential victim, trying to do harm to them, and the officer in the middle of trying to physically restrain them may in fact have to get what would be called a chokehold. They have to get an arm around their head or neck or bring them to the ground for 10 seconds, for 20 seconds, Jeff. I can't support something that would criminalize that or that would somehow
penalize that. Delegate Ivey, you disagree?
Well, I think that we should be doing more than simply banning chokeholds. Maryland was the first state in the nation to adopt a law enforcement officer's Bill of Rights, which gives additional protections to law enforcement officers, makes it more difficult to fire bad officers who have broken the public trust, quite frankly. And so that's really the first step that we need to be taking, because it'll allow us to change the culture within our police department. Right now, we have individuals who know that if they do certain things, they still won't be punished. And in the state of Maryland, it's very difficult to remove officers from police departments because they have an administrative process that favors them and a criminal justice system that favors them as well. So banning chokeholds is a good start, but chokeholds were banned in New York when Eric Gardner was murdered by one as well. So we need to do that, and we need to do more, quite frankly.
Law enforcement officers' Bill of Rights is going to be a big fight in the next session, whenever it is. Delegate Buckle, do you anticipate it'll be changed?
I think that there's a look at potentially some reforms within the law enforcement Bill of Rights system. I hope and don't anticipate that it would be thrown completely out. It's something we've had discussions about in the Speaker's Police Reform Work Group on several occasions. It's a very technical and complicated issue, Jeff. I wish it was as simple as what people may want it to be of, if we do this, then we're going to immediately get better policing, and anybody who's a bad cop is immediately going to be penalized. And all of the good cops, which is the vast majority, they're not going to have any negative consequences. It's not that simple. The Law Enforcement Officers Bill of Rights exists for a variety of reasons. And I think that you'll quickly find this: if you eliminate all of it, if you say we're just going to get rid of it, and then you go out tomorrow and say we have an excessive force complaint against Officer X, and we want an independent agency to go out and begin questioning Officer X about what he or she did with the potential for criminal prosecution. Well, Officer X has all the same rights that you and I have and Julian has, Jeff, under the Constitution, to say, I'm not going to talk to you. I have a right to not self-incriminate myself. I'm not going to make a statement. I'm not going to say anything. Are you now going to fire me with no administrative hearing, with no record of whether I did something right or wrong? Are you going to criminally prosecute me? There's a lot of fundamental issues there that really have to be examined instead of just sort of a yes or no approach to the Law Enforcement Officer Bill of Rights.
I just have about a minute, and I wanted to get your thoughts, maybe Delegate Ivey first, on the mail-in balloting idea. So the governor wants to send out to every voter an application for a mail-in ballot, but they would have to send that in before they got a ballot, and all the polling places would be open. You agree or disagree with that?
Yeah, I disagree. It's fiscally irresponsible. We should be sending a ballot to everyone's door that is a registered voter, just like we did in the primary. And it's also irresponsible and reckless to have so many elderly individuals working at polling precincts, because those are the individuals who work at polling precincts on election day. I really wish that Governor Hogan listened to the health experts on this issue, and that he was not looking to encourage more people to be, victims of a form of voter suppression and also voter confusion. I think that there's a way that we could have achieved these goals of increasing turnout without making this such an arduous and confusing process. But what we see here, I believe, is a Republican governor who's looking to increase his chances on a national primary electorate. And he's doing what the national Republican talking points are at this point.
Let me get Delegate Buckle on that just before I run out of time, sir.
I have to respectfully say, I think that's ridiculous. What we've proven, and what the problem with the primary process of just mailing a ballot to quote unquote everyone, we don't do a very good job in Maryland, just like a lot of other states don't do, of cleaning our voter rolls. So if you die, or if you move out of state, or you move from one county to the other, you don't live in the same district or congressional district anymore, we don't do a very good job bureaucratically of going back and cleaning those rolls. So what we found in the primary is hundreds, thousands of ballots being mailed out to people who may have been dead or didn't live there anymore. I have a constituent who got 7 ballots at her house for people who had lived there in the prior 5 or 10 years who she didn't even know. She could have taken each one of those ballots if she had malice in her heart or the intent to do so, filled all of them out for her preferred candidate and sent them back in. And guess what? There's a very good chance no one would have ever caught them.
Our thanks to Delegates Ivey and Buckle. Now Sue Copen tells us about a new report looking at the challenges facing many working Marylanders.
Tell me a little bit about what ALICE is and the reason behind this report.
ALICE stands for Asset Limited Income Constrained Employed. These are individuals who work 2 or more jobs every single day, right? And they just can't earn enough to keep pace with the state's high cost of living. We run into ALICE 2 or 3 times a day on average, right? At the grocery store, security guard, receptionist in an office building, the local diner. These are individuals who are so vital to our economy. They really help the economy to thrive. But our effort here at United Way and all of our partners is to find ways to increase their assets and reduce the barriers, many of them artificial in nature, but to reduce the barriers for their advancement.
And to get an idea of how much we're talking about in the way of income for these families, can you give us what we're talking about here?
Yes, so the average family in Maryland, right, the 24 jurisdictions, on average, say a family of 4, right, mom and dad and a toddler and infant, they need to earn over $69,000 per year to be outside of the ALICE threshold, right? So they're above the federal poverty level, which is a much lower number, but they're not above the ALICE threshold. So on average, if you live in the state of Maryland and you're earning below $69,000 as a family of 4, you would be considered an ALICE individual. So your assets are limited, your income's constrained, but you're employed.
And how many families fall within those parameters in the state?
So right now, Sue, there are 2.2 million households in the state of Maryland, and there are 39% or about 860,000 households that meet the ALICE threshold or criteria.
Baltimore City is really impacted by this. Can you give us kind of a snapshot of how the residents of Baltimore fall into this report?
Yes, so the number is not shocking for some it is. The number, as I said earlier, statewide is 39%, but for Baltimore City is 55%, which is literally a little more than 1 out of 2 individuals, somewhere around 615,000 residents for Baltimore City. So you think about the sheer number, right? Over 300,000 of them are meeting the ALICE criteria.
Also, as I understand it, in looking through the report, not unlike the impact of COVID-19 on communities, there are groups that are disproportionately impacted by this, much more so. Black population, other people of color, and ethnicities. Can you tell me a little bit about that as well?
Yeah, and it's not surprising to those who've been following like the federal poverty level guidelines over the years. They've been following subsidies and supports offered to communities and cities, that the same information we saw with COVID-19, the disproportionate numbers of people impacted, whether it's cases or deaths, The same applies here with the ALICE threshold. The same sort of trends of Blacks, Hispanics, Native Americans, some other Asian populations experiencing some level of disproportionality related to access to capital, access to resources, and mobility within the job space. In addition to the ALICE report, we also have worked with the Schaefer Center at the University of Baltimore, their policy center, to craft a benefits cliff study. The long and short of this benefit cliff study is there are many individuals who are ALICE, right, where they receive a slight increase in their income. Let's say it's $100 annually, and then all of a sudden they lose up to $300 per month in federal and state benefits. So they fall into what is known as the benefits cliff. So we are working really hard with our legislative partners, both statewide as well as the federal level, to find ways to graduate the impact on those individuals that face the benefits cliff.
Lots to tackle in the days ahead, to be sure.
It is.
Franklin Baker, President and CEO of United Way of Central Maryland, thank you so much for joining us.
Thank you for the opportunity.
Monday on Direct Connection, pregnancy in the time of COVID. We'll get advice for parents-to-be and family members. That's Monday live at 7. Remember to follow us on Twitter and Facebook at MPT News. And you can see our previous programs, including this week's special on race and policing, all online at video.mpt.tv. Now, for all of us here at MPT, I'm Jeff Salkin. Thanks for watching and have a good night.
This program was made by MPT to serve all of our diverse communities.
On Masterpiece Mystery.
Here! Who will be head of the company now?
I don't think that we've heard the last of it. He could be violent, unpredictable.
These always come with one of them. Calling card, you might say.
I'm not a gold digger.
You're not going in. He's armed.
What a place.
I would ask you in.
They hardly know me.
It doesn't feel like that.
Endeavour on Masterpiece Mystery.
Sunday night at 9 on MPT. You're watching MPT. Be informed. Be entertained. Be inspired.
Look to NHK World Japan for news of the coronavirus outbreak across the globe. You'll find updates and insights in the specialized section of our website.